of a hospital in your community, of a physician in your town, of a pharmacy on Main Street. And the second aspect of this, in fact, I've visited all 127 hospitals in our state, completed that 127th visit just, I don't know, a month ago, and there is not a hospital that I can find in Kansas that is financially better off as a result of the Affordable Care Act. We can have a discussion if you want about expansion of Medicaid. That's a state issue, not a federal one. But the co-payments and deductibles, because they're so much larger, means that the bad debt that many of our health care providers have has not gone down, it's gone up. So I know the importance of health care in rural Kansas. A lot of what I have been about in my time in Congress is how do we make sure that rural America is alive and well. And I know in my own circumstance, if it wasn't for the hospital in my hometown, the hospital of my parents' hometown, I'll try to help you. Not everyone is arguing with the press. We try to be helpful. So I know that in my circumstance, my sister and I would have had a conversation with my mom and dad, saying to them, I'm sorry, Mom, I'm sorry, Dad. In the absence of our hospital, in the absence of our community physicians, you need to move. And we probably would have filled in that to where, probably with Hayes. But wherever it would have been something different than what was home for my parents. And my parents were able to live in a community that cared about them, because there was a hospital, there were doctors, there was a pharmacist. All the things that were necessary for their health care existed in our hometown. And it made that conversation unnecessary, and it allowed them to remain at home. Again, with people who checked in on them, took care of them, got them to church, got them to groceries, and it would have been a different circumstance wherever else they would have lived. So